All right, welcome everyone to our third ENA Together virtual town hall. Thank you for taking time out of your day during this busy time of the year, and especially given the ongoing challenges that we're facing because of COVID-19. I'd also like to welcome members of the ENA Board of Directors who are here, including our 2021 ENA President, Ron Kraus, who we'll be hearing from in a little bit. As you know, if you've attended our previous virtual town halls, excuse me, this hour is going to move fast, but we want to hear from you, as many members as possible. So I encourage you to share your stories, your experiences, ask questions, and tell us how ENA can best support you heading into 2021. Please add your comments and questions into the Q&A tab on your screen. We'll try to get to all those just as soon as we can before the hour is up. And we'll be recording this session as well, so you can revisit if you should miss anything. Before we get into some ENA updates, I just want to share with you a few minutes of reflecting back on 2020. As I look back and think, wow, what a year it's been. You know, we had great plans for 2020, celebrating ENA's 50th anniversary, celebrating the designation of the Year of the Nurse. Well, who knew we were going to face a global pandemic? You know, this year has really highlighted the role of the emergency nurse. There's nothing better than to be an emergency nurse this year, I have to say. You know, watching the way that we have innovated and have adapted to the pandemic and provided the care for our communities is absolutely amazing. I know that this year has been challenging. You know, I face it myself day to day, but I just want you to know that I'm super proud of all the work that you've done to take care of yourselves and your communities. So thank you from the bottom of my heart for everything that you have done this year. And I look forward to the continued success of ENA in the future. And I know that ENA is in great hands, and I look forward to it. So we're going to highlight some of the things that we've been working on currently right now. So, but Dan, I just want to see, as we kind of look back, do we have any kind of comments or reflections that anybody has already posted so far in our chat window?
Yeah, Mike, so during registration, a few folks did share some questions and comments. And I'll start off with a reflection from Jim Allday. He offered a description of some of the things that he's going on within their ED resuscitation unit as it relates to now requiring them to wear their N95s and eye protections for every patient all day. And, you know, really how that's, you know, wearing on them a little bit, because it's just another way that, you know, they're, you know, sort of physically and mentally, you know, being pushed to the limit, and obviously being done in a way to help protect patients. But it sounds like there's a little bit of, you know, wear and tear that comes from that, you know, obviously, as these requirements keep changing. So that was a reflection from Jim. Some thoughts from you on that.
Yeah, I totally echo those comments and concerns, Jim. You know, definitely wearing the PPE all day long with the face mask and eye shields, and changing in and out of gowns and stuff. It definitely is very taxing on you personally. You know, from a physical standpoint, we know that most likely you're not drinking your water or your fluids kind of throughout your shift as well, and so that takes a toll on you. So unfortunately, it's something that we're all facing, right? I wish that you know, we had a magic answer for that on how to prevent that, but the key is really making sure that you're staying safe. As we face the pandemic, you know, we're going 9-10 months on, depends on how you want to do the counting off of it, is that we want to make sure that you are staying safe and you're using that PPE the way it's supposed to be. As we get tired, sometimes we allow those things to kind of, you know, go to the side. So please make sure that you're focusing on your own health and making sure that you're wearing that PPE correctly, not only yourselves, but your coworkers as well, and make sure that you're taking care of yourself.
Mike, that's a good segue. Another reflection and sort of question that came up was, how are ED nurses and technicians and others in the ED receiving the mental health and stress decompression counseling? You know, is it happening sort of commensurate to as things have developed? As you mentioned, we're 9-10 months in, but you know, or is it, you know, going to happen all at the end? So how are nurses working through some of those things to maintain that mental health and well-being, which has been so important throughout this? So that was sort of a reflection and a question.
Yeah, totally. Thanks. Yeah, definitely the mental health and well-being is definitely a huge priority. One of the things that ENA has definitely done is the connecting through conversations, that peer-to-peer kind of nurse support things. We also have our conversation circles that we're doing as well around your own well-being and things. We have one that's coming up. I know, I think we'll send a link in the chat window as well coming up about that. I know a lot of healthcare organizations have their own well-being initiatives that they're doing for their workers as well. So make sure that you're checking those out. And pretty much every health or organization has an EAP program as well, so an employee assistance program that provides confidential resources for you as well. So as a leader in a hospital, I know that that is definitely a underused resource that's there. It's free for you, so make sure that you're tapping into that.
So one other reflection / question revolves around retired ED nurses who are still looking for ways to give back, and I take this obviously within the COVID context, but also in general when you're talking about how to support frontline, everyone on the front line who has been dealing with so much this year. So Mike, some thoughts or reflections on are there some simple ways that they can show that moral support, but maybe also get active in ways that use their skill set, even if they're not working bedside currently?
Yeah, so great. So, I mean, once a nurse, always a nurse, right? So, and as a nurse, we want to care for each other. I'll tell you some simple things that I tell people, is that you can reach out to your local emergency departments and offer your support, right? What does that look like? Is that just sending a simple card to say thanks? As emergency nurses, we don't hear all the time back from our patients or from our communities to say thank you. So sending a simple letter, simple card to say thank you, that you acknowledge the work that they do, that means a lot. Some emergency departments are still allowing food donations to come in, see if there's something that you can help out with that. Or getting involved with your local health department as well. I know local health departments are looking for resources for nurses to be able to help do contact tracing and things. So again, this is all remote kind of work that you want to do. And also, you're a nurse, so use your voice as a nurse. As we educate our communities about, following the CDC guidelines of wearing the mask, social distancing, the information that's coming out about the vaccines, about making sure that they get vaccines, using your voice as a nurse. Again, nursing, we're the most trusted profession. So it's a chance for you to be able to use that voice. So thanks for those comments. Again, please make sure that you continue adding those comments in, questions, and throughout this presentation, we're going to get to some of those. So thanks again for sharing. I understand that, emergency nurses right now, we're tired. We've struggled, but hopefully together, even the small bits of comfort through this long year, we're going to get through it. So unfortunately, it's not new to anyone that COVID today is still here. Cases have surged across the country. Unfortunately, it's not just a regional, like we've seen previously. It is truly across the country. You and I are seeing this in our EDs, and of course, the pandemic continues to have an impact on our personal lives in a variety of ways. So call me optimistic though, but I do see a glimmer of light ahead in the new year with the expected rollout of the FDA approved vaccines. We're waiting for that release any day now. ENA has been steadfast in calling on federal and state officials to ensure that ED nurses are among the ranks of the frontline healthcare workers who are given priority as part of the initial wave of vaccinations. ENA believes emergency nurses should receive recommended vaccinations to promote public health and to promote community awareness of the public health consequences of under-immunizations and non-immunizations. Getting vaccinated will help reduce your risk of infection, but think of also who else you are protecting by taking that simple step. I understand that there's a lot of skepticism out there, but ENA is driven by evidence and science. The vaccines nearing the point of FDA emergency use approval have endured a federally regulated process that involves a high level of scientific scrutiny. We've all seen too much at this point to believe that these initial vaccines are somehow worse than contracting the virus itself. And while it's important for ED nurses to do what is best so that we can continue to care for our patients, we must also look at ways to ensure the widespread distribution of vaccine is done properly. Keep an eye out for more vaccine information and for our awareness campaigns coming soon from ENA. As several members have already since my message to members last week, please let us know if you would like to volunteer in ENA's efforts to encourage vaccinations. ENA is proud to support the COVID-19 Vaccine Education and Equity Project and its mission of equitable access to vaccines for everyone. Our voice can help those efforts just as it has in other ways through this pandemic. Learn more about this project and its goals by visiting covidvaccineproject.org. Speaking of websites, the ENA COVID-19 page continues to feature clinical resources and other information, including a new section focused on vaccines. Be sure to check it out for updates. We're always looking for most relevant content for the resource page, so please share your thoughts on these topics you'd like to see that can assist you in your practice. The ENA Foundation recently awarded its 450th COVID-19 relief grant to an ENA member in need of financial assistance. Because of the pandemic, in total, the foundation distributed approximately $260,000 in grants, just an amazing way to help our members at a time when they needed it most. Giving season continues through December 31st, so I ask that as you can, consider a donation to the foundation, especially if you have benefited from a scholarship or grant from the foundation in the past. This is a great time to pay it forward. In fact, you can do it right now if you're inclined. Text Giving Season 2020, all one word, to 44321. Any 2020 wrap-up has to include a mention of the amazing In Case of Emergency documentary. Nearly 10,000 people watched the film's premiere on October 14th, and tens of thousands more have seen it at film festivals during the free streaming window after the premiere and by renting or purchasing it. We're excited to announce that In Case of Emergency will debut for on-demand viewing through Amazon and iTunes beginning on December 22nd. The film's powerful message and portrayal of emergency nurses have resonated with many people, including judges at several film festivals. In Case of Emergency earned the Boston Globe's Globe Docs Audience Award for Best Film, the Charging Documentary Film Festival Rotary Service Over Self Award, and the Gold Coast International Film Festival's Audience Award for Best Documentary. Those accolades are tremendous, and so has your feedback since the film's premiere. You can tell the world what you thought of the film by leaving a review on sites such as IMDb and Rotten Tomatoes. So Dan, just checking in and see if we have any questions or anything so far.
Yeah, we do have a couple of questions that are in the respect of vaccine education. And I know that that was a big topic of discussion with the board meeting this week. Would you kind of, maybe just follow up a little bit more on really what ENA sees its role, whether it's nurse to nurse or eventually nurse to public, in terms of what we see our role as these vaccines become available?
So the board did meet over the last couple of days. So we had robust discussion at the board level about this and what is our role. So obviously as ENA, we totally support the vaccine. We've looked at that research and that science behind it. And so we're going to figure out ways that we can help get information out to you, so that way you have that information and so that way you can make your informed decision about getting the vaccine, but also make it so that way you're able to help talk to your peers from a nurse to nurse perspective, but also to your communities. We have to remember that nurses are the most trusted profession, and so we have to use that voice right now. I mean, our communities are looking for a place to get reliable information, and so the nurses need to be able to be out there and help educate our patients. Something that we do every single day with our patients is that we give them discharge instructions and we talk to them about their well-being, right? So this is just another way that we can use our voice to make sure that we are helping to combat COVID-19, is by trying to help get people vaccinated.
And one other question, Mike, in the realm of sort of day-to-day practice as well. A comment and question related to hospitals that have begun sending COVID positive patients to the waiting room instead of immediately isolating patients from others. Asking whether there's some advice that ENA has, in that regard, or maybe just even your own personal experience of how to manage. The numbers are the numbers and the space is the space. So a little bit of a thought from that standpoint of how to manage when you've got those types of situations.
Yeah, so it's such a tough situation, right? Because typically what we want to be able to do is isolate any kind of potentially infectious people outside of our waiting room so that way we're not cross-contaminating. However, because of the volumes, most of us don't have the luxury to be able to pull everybody back into rooms and get them isolated out. So one of the things that I know that we face in my own institution is that we have part of our waiting room is blocked off for those people that are potentially COVID patients or already known COVID. So that way we're segregating out the waiting room there for you. So think from a kind of from a disaster standpoint when we talk about hazmat and decontamination, right? And so that way we're really creating up a separate little hot zone for our patients in the waiting room. So those that we believe are contaminated, for lack of a better word, right, that potential have COVID, is that they're in one section, and then our cold zone are those patients that are presenting that, that have a non-COVID presentation or very low risk of concern for having. All right. So thanks for those questions. Again, just make sure that you're popping those questions in there for us and we'll get to them. So like I said it many times that I can remember, but things certainly looked a lot different from expected in 2020. You all have stepped up in countless ways, putting yourselves in harm's way to care for your patients and your communities. I cannot thank you enough, and I cannot express enough of how proud I am of all emergency nurses, particularly our ENA family. But as we put 2020 behind us, there's much to look forward to in 2021. So let me introduce 2021's ENA's president, Ron Kraus, to give us a glance at what's to come in the next year.
Thanks, Mike. In many ways, it certainly felt like 2020 owned us, but we've taken every challenge that's come our way with that emergency nursing spirit that we all know so well. That doesn't mean we're not tired, stressed, and frankly, felt a little beaten up. Let me set the tone for next year by saying we will own 2021. There is tremendous potential lurking around the corner when we turn the calendar page. Potential for ENA and its members to elevate ourselves, one another, and the emergency nursing as a whole. How do we elevate and how do we make 2021 great? What does that look like? Is it getting certified? Challenging a colleague or a friend to elevate themselves by getting certified? Is it going to a state council or a chapter meeting for the first time? Is it getting involved in a local committee? Is it elevating some of your coworkers to finally join ENA and show them what they've been missing? Is it volunteering in your community to elevate a youth program? The choices and ways to elevate ourselves and others is endless. The real question is, what will you elevate and who will you elevate? Let me start with some truly breaking 2021 ENA news from the board meeting this morning. The board decided that given the current state of the COVID-19 cases and local, state, and federal guidelines around the country, our annual gathering of state and chapter leaders in January will be a fully virtual event. Although it's disappointing we cannot be together in Arizona, the two-day virtual event allows for even more of our local leaders to learn and network with their peers. There will be an on-demand content as well. I'm also excited to announce that the event will have a new name starting in 2021, Leadership Orientation. This change reflects ENA's growing commitment to our international member community. State and chapter leaders, keep an eye on your email today for more information about Leadership Orientation. Registration, which remains free for the eligible 2021 leaders, opens next week, and full education lineup will be released in early January. All of it will be available in the state and chapter leaders area of the ENA website by visiting ena.org/membership. Even with a new name and a virtual format, Leadership Orientation 2021 still has the same commitment to prepare our local leadership with the tools, resources, and community it needs to be successful in the state and local level, while also partnering with members around the world. I saw a little bit of preview of the content and it's going to be awesome. So I'm looking forward to it. Based on that news, we all know that COVID will still be with us in 2021. So the focus of us ending this pandemic is growing clearer with vaccinations looming. With nursing, including emergency nursing, seen as the most trusted profession around, we have an important role to play in shaping attitudes about vaccinations. As Mike mentioned, ENA is putting together a campaign that encourages ED nurses to get vaccinated, and as we move to a wider distribution, encourages the public to do the same. This is a public health issue that we can use our voices loud and clear. This will be our chance to elevate our communities to grow safer by reducing the spread of the virus. And it's something I hope we're all doing now by promoting social distancing, frequent hand washing, and continued use of masks. I can't emphasize this enough. We need to turn to our neighbors, our friends, our colleagues, and dispel any of those rumors, etc. They are looking to us. It is very important. Our government relations team is poised again to elevate ENA on key emergency nursing issues in Washington as the new administration takes the reins in the federal government. ENA will continue to be leading voice on a number of priorities related to the COVID-19, including availability of PPE, protecting nursing jobs, and ensuring that the hospitals and other healthcare facilities take necessary steps to protect workers, which includes looking out for our nurse mental health and well-being. Barring anything unforeseen before the end of the year, our priority legislation relating to suicide screenings and workplace violence will need to be reintroduced next year with the new session of Congress. We will also continue to focus on mental health, behavioral health issues because their importance to emergency nurses has never been greater. Thanks to our government relations team for their hard work in 2020 and everything they're going to be doing and it should keep them busy in 2021. Circling back to workplace violence for a second. We all know this has not gone away just because of the pandemic. ENA and ACEP remain committed to the No Silence on ED Violence campaign. Let's not call it a relaunch in 2021, but we're working on ways to reignite that conversation to once again elevate the awareness about the problem and find solutions to address it in ways that help make our emergency departments safe. And no look ahead in 2021 is complete without mentioning the continued importance of advancing the conversation about diversity, equity, inclusivity. ENA has taken a mindful approach this year to better understand DEI-related issues, including systemic racism, so that as an association, we can develop ways to help address it in the emergency nursing community. Doing so benefits our patients and our communities as much as it elevates ED nurses professionally and personally. Our DEI committee is a key part of how we'll move forward in our new year. Lastly, I want to reiterate something that I said during EN20X. 2021 is the time to lean on each other. Check in with your friends, your families, and your colleagues. We hear people say it a lot, we may even say it a lot, but do we actually do it? I commit you a challenge to check in on each other frequently and help elevate each other. Let's use the fresh canvas of 2021 to elevate ourselves, our loved ones, our colleagues, our profession, and ENA to an even higher level. We must continue to drive to become better nurses for ourselves and our patients, better friends to each other, and strive to be better people in general. We are poised to make a huge impact in 2021. And as ENA's 50th president, it will be my honor to lead this great organization as we do it. Now, speaking of great leaders, Mike, wow. We made it through 2020, thanks in a large part by your leadership. Hopefully you understand how deeply appreciated you are. But here's a little something to make it absolutely clear.
When every day goes from bad to worse, that's when we need to be resilient. Those lyrics from the song Resilient pretty much describe the year 2020. Through all the challenges that our members and ENA has faced in 2020, our president, Mike Hastings, has been the face of resilience. In his own ED and as ENA's leader, he continuously exemplifies the characteristics of emergency nurses everywhere by showing strength and commitment while also demonstrating compassion and understanding, even in the toughest moments of a most difficult year. As the song says, we'll survive this in the end, and the world will be bright again and even more brilliant. Mike, he never gave up and never, ever let us lose sight of brighter days ahead. So on behalf of ENA staff and ENA leadership, we dedicate this video of Resilient to our President Mike Hastings to thank him for all he has done for ENA in 2020. Thank you, Mike.
When the battle swords are drawn,
and it feels like the final dawn,
the key is to be
resilient.
When all options seem perverse,
every day goes from bad to worse.
Then we need to be resilient.
Never swerve and never bend.
We'll survive this in the end.
And the world will shine again and be brilliant.
this is war, a raging tide.
And we're all on each other's side.
Agree,
We will be resilient.
Never swerve and never bend. We'll survive this in the end. And the world will shine again and be brilliant. Never swerve and never bend. We'll survive this in the end. Yes, the world will shine again and be even more brilliant. Resilient, fight to be strong. In this together we will go. Resilient, don't be afraid, fight to be strong. In this together we will go. Resilient, don't be afraid, fight to be strong. In this together we will go. Resilient, don't be afraid, fight to be strong. In this together we will go on. Don't be afraid, fight to be strong. In this together we will go on. Resilient. Yay. Okay.
And you guys want me to be able to speak about that? You want me to speak after that? Wow. No, just whew. Thank you, everyone. I mean, it's what a year it's been. It's been truly my honor, though, to represent ENA and through this year. So, as a leader, you know, one of the things that, and before I ran for the president, it was the question was, what can I do for my association, right? I don't want to be president just to be president. It's definitely not just something to put on my resume. It's that I really want to be able to help the association to continue moving forward. And so we've done great things this year. Granted, it wasn't the year that we wanted, but you know what? We've done amazing things. And it's all the hard work that you guys do every single day. You know, we have an amazing staff at the office that do all this amazing work for us to help support us on the front line. So yeah, wow. So thank you. It's been truly my honor. ENA is in great hands moving forward. And so in just a matter of weeks now, I'm going to turn those reins over to my friend and Ron, and you know, great things we're going to continue to elevate in 2021. So thank you. Again, just thank you. That's all I have to say off that. And speaking of thanks, I do want to also give my sincere thanks, though, to a couple members of our board who will be moving on at the end of the year. So Patty Kuntz-Howard, Gordon Gillespie, and Micah David, all will be ending their term on the board at the end of the year. So I just wanted to say thank you to the three of them for their commitment to ENA. And as Micah is our emerging professional liaison that will be leaving, we look forward to your great career path and see what happens in the years to come with you. And thanks so much also. I know, Micah, we got to help celebrate your birthday all together during our ENA board meetings as well. So hope that you had a great birthday. And again, thank you. And Patty and Gordon, thank you so much for your leadership. And we look forward to seeing what you provide for ENA moving forward as well. So with that, I do want to open the floor up to see about some other conversations or any questions that have been posted, Dan.
So we've got a couple of, we talk about succession in the pipeline. We do have a couple of questions that are tied to how ED nurses and ENA in general kind of view support for nursing students who may be contemplating the ED with they didn't have the same hands-on experiences this year. So really, the questions kind of circulate around, the idea of how can, they be supported moving forward, to further their career if the ED is where they choose to, knowing that they didn't get the same opportunities maybe that under normal circumstances they might have.
Yeah, so it's definitely a hard transition period with COVID, right? Because I know that you don't get those clinical times. So one of the things that I say is make sure that you're looking for a place that has a residency program that has a solid orientation program for you, so that way you can be successful. And just make sure that you're giving yourself patience and grace with that as well, is because, we know clinically that without those experiences, that you're just not going to be at that same point when you come into the emergency department. My ask also then is for those of you that are currently working in the emergency department, who will be working with a new grad coming in, is to make sure that you give them grace as well. Just remember back to your first days working in the emergency department, how scary it was. Everything was so new and foreign. Just think for them, that's what they're facing right now as they come into our strange environments. So have some patience. You'll get through there. I'd also make sure that you're engaged with our emergency professional liaisons as well with that community on ENA Connect. It's a great way for you to be able to connect with them and find other resources and get involved locally within your ENA community, whatever, if it's a chapter or state level as well.
In sort of a similar respect, this maybe isn't necessarily ENA related, but this could certainly reflect on what you've experienced in your day-to-day world, Mike. But, are Ds planning to hire new grads in 2021, or is the decline in new grad hires expected because of the pandemic and some of the financial implications that some facilities may be seeing? That may be more sort of in your workday life realm as opposed to ENA, but what are you seeing with that side of things?
Yeah, I can say just, personally, and from my conversations with other leaders, is that there's no changes in that. We're still hiring. I know I have 3 that I'm starting off in our next cohort in March that I'm hiring myself. So I don't see that changing any. One of the things that we have to worry about is our workforce. And so we constantly need nurses. And so I don't see that changing too much.
So also have a question looking at sort of the state of ENA going into 2021. A question was raised about, ENA's financial footing and certainly, what does our membership look like at this point as we cross over into 2021?
Yeah, so hopefully you all have heard the exciting news. So the year of our 50th anniversary, we kind of had an unofficial goal to hit that 50,000 member mark. We hit over 52,000 members is currently our membership, which I have to tell you is quite amazing because one of the things that we've worked with other associations and the fact that other associations, their membership didn't grow this year. In fact, several of their memberships actually declined. Yet ENA saw that our membership had a substantial growth, actually, which really tells us that we are doing what we need to do for the emergency nurse, and that they feel that their association here has those resources for them. So we're going to continue figuring out ways that we can help support that frontline nurse there and make sure that they have those resources because we do want to be that one place for them. And so we're going to continue working on that. As far as financials, so one of the things that our team did this year was actually, we essentially kind of had to throw out our 2020 budget. And then we redid that 2020 budget kind of mid-year here. And so again, it was the great work of our office staff that did all this to make this happen. I can tell you our budget is actually coming in better than what was projected. And so by us being able to pivot and change quickly on some of the things that we were going to do, we were able to decrease our expenses. And so our budget is actually quite good from what 2020 has been for many places. So any other questions or comments? One of the questions that we have up there on the slide as well is how else can we support you? So what else? Is there something else that ENA can do to help support you from kind of day to day, or something that you feel like we should be doing different? Make sure that you're providing that feedback to us as well. Dan, is there any other questions that have come in?
So we'll buy time here for, while we wait to see if there's any other questions. We'll mention again that this entire presentation will be available through the COVID-19 resource page for people to watch later on, or if you want to share it with some folks that maybe didn't make it, so they can get a sense of what we were talking about today, and see, of course, Mike get emotional on camera. I mean, that's all great things to share. And speaking of Mike getting emotional on camera, the resilient video will be shared on ENA's social media a little bit later this afternoon, so folks can share it from there and leave their comments and thoughts about the video itself, but more so about Mike's leadership in 2020. So we'll buy a couple more seconds here, Mike. I'll ask you one question. You and I have talked so many times throughout this year. You've dealt with so much in your own working world, and then crossing over to ENA. Is there one, and this is a true spotlight, on the spot question, but is there one moment that sort of epitomizes for you emergency nurses or ENA based off of all the things that you've seen, experienced, and all the people that you've talked to throughout the year?
Oh, is there one? Oh gosh. Gosh, man, Dan. Geez. I can't say there's really one moment, right? Like, I mean, because it's really the messages that we've heard from each other, from the frontline people that have said, what an impact, and with the resources that ENA has had, that has pulled together to give to them. Excuse me. So that way they have the tools and resources that they need to be able to care for COVID patients. I think, it's just very ironic, right? I mean, my ED was one of the first EDs in our country to face COVID patients. I had nobody else to lean on, right? Like, I had no guidebook by any means of what we did locally in my own ED. But thankfully with the ENA, I was able to help share some of those resources of what we were doing, what was working. So that way, as other EDs face these same questions that we were going through, I could say, well, we tried this, it didn't work, so that way people weren't necessarily having to recreate the wheel all by themselves. And I think that really speaks to the networking capabilities of ENA. We're not in this alone, right? And so, especially I think as you review back on the in case of emergency, right? So we highlight multiple emergency departments there, right? And shows these are the same problems we face every day in all of our emergency departments. And I think that every day, kind of when we work in our own emergency departments, sometimes we can kind of, get complacent, for lack of a better word. We can kind of get down because we think, oh my gosh, my place, we have borders, we don't have any throughput. And I think, so highlighting in case of emergency shows that these are the same problems that we have everywhere across our emergency department. So we're not in this by ourselves. We are in this together. And ENA is there for you, and we'll get through this no matter what.
So we actually had two comments while you were talking. The first one from Joni Soames. I think certainly she couches this as coming from everyone across ENA membership, but especially Minnesota. Thanks, Mike, for everything this year. You are the best, and best wishes to Ron in the coming year. So I'm sure that everyone echoes that thought. In respect to both of you. And then from Terry Foster, the board of directors, very own Terry Foster. he shared, his thought in kind of that vein. I think Mike's defining moment was when we were in Chicago for the board of director meeting in March, when we felt the world change before our very eyes. His response was calm and collective and set the tone for us all. So in case Terry hadn't shared that with you directly, he chose a public forum to make sure you knew how he felt about your leadership this year.
Thanks, Terry. Yeah, I mean it's something that I've heard from people to say, hey, thanks for that calmness and showing it. And I guess that's just kind of me, and I guess as an ED nurse, right? Like we're thrown with new adventures and challenges every single day. And somehow we just have to figure out how to make it work. And so, trust me, I'm not the one that made it work, right? It's our amazing staff and amazing board of directors that have contributed to the great work that we've done. So thank you to all of them. So, but just like that, like I knew it would, our time has flown by. So again, let me say thanks for you all for spending the time with us today and your ENA peers. Remember, hashtag ENA Together isn't just a hashtag. It's a true feeling shared by me, the board, ENA staff, and many, many members. Like I said, it has been a true honor to be your president in 2020, and I'm going to get emotional again. It's given me a front row seat to see your collective strength. So please stay strong. Always know that ENA is here to help support you, and please be safe. And I wish you and your families a very blessed and happy holidays. And thank you for everything that you do. Please take care.